Hibiscrub is an antimicrobial cleanser that contains 4% chlorhexidine gluconate. It has been used in hospitals for over 45 years. Hibiscrub kills numerous microorganisms and also removes them from your skin as you wash and rinse your body. Hibiscrub provides immediate and long-lasting protection. First, remove all makeup, nail polish, jewelry and piercings. Cut your fingernails and toenails short and remove any false nails. Wash twice with enough Hibiscrub, first to cover the body, then to cover both body and hair. Wet your face and body and step away from the shower jet. Turn the tap off to save water. Apply undiluted Hibiscrub directly to your skin. Start from the top and work your way down. First, wash your face, paying special attention to the area around your nose. Microorganisms tend to get lodged there. Avoid contact with eyes, ears and mouth. Wash your torso and back. Be especially careful around the armpits, navel, groin and genitals, and avoid the body's orifices. Hibiscrub is intended for external use only. Proceed by washing your legs and don't forget the areas between the toes and the soles of the feet. Then turn the tap back on and rinse thoroughly. As the chlorhexidine has bound to the skin, the product will remain active even after it has been rinsed off. Now repeat all the steps above, but start with your hair. Rinse thoroughly and dry with a clean towel, paying special attention to skin folds and the areas between the fingers and between the toes. Put on clean clothes. Do not use any creams, powders, oils, hair products, deodorants, perfumes, makeup, or nail polish. Do not wear any jewelry or piercings either. You are now ready for your surgical procedure. Always read the package insert leaflet before using Hibiscrub. Consult your physician, nurse or pharmacist, and always follow the hospital's protocol.